Morning, everyone. Welcome to TeleShadowing. We are recording this session and live streaming it to YouTube. We will be having a Q&A session at the end, and you can ask questions in the YouTube Live and Zoom chats, and they'll be addressed.
Good morning, everyone. I'm honored to introduce our mentor for today, Dr. Parivash Badar. Dr. Badar is a family medicine resident at the Baylor University Medical Center in Dallas. Born and raised in Pakistan, Dr. Badar spent some time doing preventative medicine research before applying for residency. Her goal is to provide comprehensive care for most underserved populations, nationally and globally. I would now like to request Dr. Badar to start today's session. Thank you.
Great. Hi, everybody. Good to see you all. Great Saturday. Okay, super excited for this. I think it should be fairly short and painless for most part. And feel free to write in the chat if you have any questions. I'll be looking at it as well, and I'll be trying to answer questions if I can. I'll do my best. And then at the end, we'll give some time for questions too. So we can do that. But other than that, if y'all can see my screen, it's just a pretty simple presentation that I put together for a family medicine resident. Life is a little bit stressful at times. It is a little bit easy too. Because we choose family medicine, there's always a reason why we would do that. And for me, my reason was a lot of things combined. And so I just wanted to put together this presentation to give you an idea that there's a lot that entails in family medicine, and things that we do are a little bit unique. And if you hadn't heard about it, or if you had questions, this would be a great time for you to think and ask me questions, and I'm happy to help. So just gonna move on to the next slide real quick. Just a little bit about myself. So I'm actually an IMG. So I grew up in Karachi. I grew up in Pakistan. That's where I did my med school. And then I moved to the States a few years ago after to actually pursue a research position at a college at a college in New York. And at the time, because my school curriculum really lacked a lot of research, and so that's what I wanted to do for a while. And that's what I had been hoping to do before I started residency. So I did that for a couple of years. I did some research in neurology, and then I moved to Texas and I did some research in cardiology, because there's a lot of research that goes into these big fields because they're ever changing. And at the time, I wasn't sure what I wanted to do. So both of those things had kind of fallen into my lap. And every time they did, I was like super into it. And so I was like, maybe that's what I want to do. And constantly there was a struggle in my mind about what I wanted to pursue as a career, because I definitely liked everything. I like taking care of older people. I like taking care of babies. I like taking care of pregnant ladies, and I wanted to incorporate all my medical knowledge for all of them, all age group. And so it was like really hard for me to figure out, what do I want to do? Like, where do I want to apply for residency? So then finally, I was like done with my boards. I have been doing research for a while. All my mentors had been pushing me to apply for residency. And I decided to apply for residency March of 2020. It was definitely very hard, especially for an IMG. It was definitely harder too. I had to, put in a lot of work and effort in my resume. I had to really show up and do a lot of audition rotations and show that I was really interested. But after doing a whole bunch of that stuff, I realized that maybe what my interest was family medicine, because that did allow me to do both kids, and then also like older people, and also like a little bit of like pregnant people too. So it helped me like kind of narrow it down to the fact that, okay, maybe I don't want to do adults the whole time. Maybe I want to do just a jet broad spectrum medicine. So applied to family medicine residencies, and then I matched at my first choice, which is my Baylor University Medical Center program here in Dallas. I have family here. We have a house here, and so I wanted to stay here, and this was perfect. The program is amazing because they are more focused on underserved medicine. So it was something that was very unique, and not being a ruler program, but also focusing so much on underserved medicine is what I wanted to do anyway. So it was perfect. And so, yeah, so far, residency has been pretty good too. Can't complain. But yeah, that was basically a little bit about my journey and how I ended up there. We'll move on to the next slide. So, just a lot of the med students are unaware of family medicine for some reason. Even the med students that we have who come in for our audition rotations and internships and observerships are always telling us like, oh, we didn't know in med school for the longest time what family medicine was, or like if this was something that was fun. And so overall, family medicine folks or doctors like us have a really high burden of taking care of our patients and being the frontliners, as we call it, for patient care. Because the way that the insurance system is made in the United States, particularly even, is that you have to go through your PCP to get to a lot of specialists. And if your PCP is good enough, they should be able to take care of you and give you a very comprehensive care. They should be able to take care of your children. They should be able to take care of your parents and your grandparents. And so it's like a whole family affair, which is the best part about being a family medicine doc, because you are taking care of patients regardless of their age and their health condition, but you're also forming a relationship with them. And that's like a very enduring and trustful relationship because you're seeing their family members. And so that feeling is great. And that's something that's very unique to us because a lot of the other specialties don't have that. Patients will go to them when they're really sick or when they have problems, and then that would be it. So that's something that I particularly want for myself. I like to maintain relationships with my patients. I love that feeling. And then, like I said, we also serve as the first contact. A lot of the times our patients come to us first thing, and then they're like, I don't know what to do. Who should I go to? And then you're the one thinking, okay, you know, maybe this is like something that I'm more than comfortable treating. Like I can help you with heart failure. I can help you with heart hypertension, but there's a rash that, I have tried something for and didn't work out. And then I'm just like, okay, maybe you want to see dermatology for this. So then I'll send them off to dermatology. But for most parts, like you are the first contact. And then, because you're their family medicine doctor, you're also navigating the care system. You want to be sure that you're on page with all your complex patients' care teams. You are in contact with all the specialists that they see. And most of the time, the specialist will usually let us know what's going on with the patient. If there's a patient of ours that have been referred over, but we all kind of work together. So that's how just it works out. You want to make sure that you're on board with everything that's going on with your patient. Each and every issue that they're having and what they're doing for it. So you're on the same page, the patient's on the same page, and you provide really comprehensive care and follow-up. Other than that, we use a lot of our time and effort to enhance their care by, running prior authorization for medications that they really need, spending time to talk to these pharma companies and letting them know why my patient will need something. So these things are something that, is our responsibility, and we really take care of those things. And then, like I said, again, each family member's health is your priority. And most of the time when I see patients, like I'll see like mom, and then she'll be like, no, I'm gonna have to bring my kids, and then she'll bring her parents, and then her in-laws. Like, so it'll just be a whole family affair, which is just so wonderful. It's so much fun. You get to know them as a family and their practices and how they live. So I love that. And then overall, like, I think when you are working so closely with a particular community, you're seeing all of them, especially in like rural settings where you are the only doctor and you're seeing everybody. It's great because you have to understand a community level like factors and social determinants of health that are part of that community. So like my clinic down in south of Dallas is mostly Hispanic and African American population, and they're usually, do not have insurance, or don't have jobs, or are homeless. And so it is important for me that when I work there and I meet their family members and I'm constantly working in a particular community, it kind of becomes important for me to understand what the social determinants of health are in that particular community. What are the resources available, or what can I do to make more resources available for my patients? So there's a huge social factor to being a family medicine doctor. I have gone in rooms with my patients, and they've told me, they've cried, they're like, we don't have a job. And so I'm just like, okay, well, let me know what I can do, because I would love to help. And then I'm gonna go see what I can. So that we'll have a social sciences, or like sociology, social work intern, or someone from there, and then we'll just like kind of relay that information to them, be like, hey, my patient needs help. And so then be like, okay, this organization is helping people find jobs and pay them for doing some work. And so we'll like plug our patients with them, or if they need exercise, or they need like more group training, we'll send them off to these kind of like organizations that are doing that kind of work. So there's a lot that we can do. Their housing, and food pantry like documentations that are available for us to make sure that our patients eat, or they have a house that they can stay in. And so those things, when you do that for someone, I think it's a great feeling. It actually shows that you care. And it's a huge impact that you'll make on someone's life too. So, there's a lot that you do. You don't do it all the time. You don't do it for every patient, but every now and then when you do that kind of stuff, it's great. It's very fulfilling. On to the next one. So other than all this hard stuff that's very emotional and it's hectic, there's some other perks to family medicine, particularly why I chose it too, has a great work-life balance. um Depending on what you want to do, you can do like a hospitalist position where you're in the hospital and you're just seeing patients in the hospital, or you are an outpatient family medicine doctor doing a 9 to 5 clinic. Regardless, there's a really good work-life balance. We don't often get calls in the middle of the night that we have to rush off to. Our hours are not crazy, like you get there at 9, you get off at 5. And then, overall there's chances for you to take vacation. You're probably off on the weekends. If you're working a hospitalist shift, you probably have to work only 15 shifts a month. So the work-life balance is great. And overall, several trials, data, studies have shown that the work-life balance, or like the amount of rest that a physician gets, positively affects their ability to work and to make great decisions for their patients. So when you're happy, you've had ample time to sleep, to exercise, to spend time with your loved ones, you're definitely going to provide better care to other people. And so that's why I love that. And then, like I said, we are the frontliners for a lot. And so we're always needed. There's never like a point in time where like, oh, we've way too many family doctor bed, because no, that's not possible, because there's the population keeps increasing too. So always needed. There are great amount of jobs that are available for different kinds of positions, where however you want to schedule your life. And so just the way that the insurance system works as well, and how they need the PCP's referral for a lot of the specialists, more and more PCPs are needed. And I know that there's some that are really great that are older, but I think that younger folks, like over time, prefer younger PCPs. And so whenever I see someone who's closer to my age group, and he's more likely to open up to me just because I'm a younger person. As I get older, things like that may change. And so for our ability to reach out to adolescent population, and just the younger age group population, I think they constantly need young family medicine doctors to come in and kind of bridge that gap. So that's very important. The compensation for family medicine doctors is pretty good too. You know, most doctors will certainly make enough to be happy. I think the 2020 review said that most doctors made anywhere from 250,000 to 350,000 a year, which I definitely think is really good. You're fairly compensated for the amount of work and effort that you put in. Obviously, if you were a family doctor that did a lot more procedures, that did like Botox in clinic and stuff like that, then you would make a lot more. But so far, the base rate for our salary is pretty good. And then there are several opportunities to evolve too, just based off of that. You can be a family medicine doctor, or you can pursue a fellowship and be specialized in something and be a specialist. There's several fellowships that are available. We'll talk about that in a minute. But for most part, you can go into administrative positions. You can go into community health positions. And then you can go into academics, you can go into research. So there's like a lot of other opportunities for you to evolve. If you just don't want to do the bread and butter family medicine role, there's a lot more that you can do too. And those opportunities are definitely a lot more prevalent in the more like the city areas, the big cities, small cities even. But if you want to practice rural medicine, then you are good to go even in rural medicine, take on several roles together, as you can be in academics and you can be in clinical medicine. So there's plenty of opportunities to evolve in this field as well. All right, next, just a little bit about family medicine residency. Family medicine residency is like any other residency. It is hard, it is very challenging. The hours are really, really brutal. But I think just 3 years of slave work is definitely acceptable for the life that you're going to get after and how much you learn. So yeah, my residency program definitely is very competitive. We have residents from all over the world here, and we have all specialties working in the same medical center. So there's a lot of, interaction with other specialties, with other people from different backgrounds. Hours can be really hectic. Like some of my rotations, I don't get weekends off. I will just get one day in the week off, or a few hours off, really. We do night shifts in several rotations, and several rotations will make you work like a 24-hour shift every few days. And sometimes there are weeks that I will go over 80 hours. So I will clock more than 80 hours in a week. But then several times there are weeks where I would be done in like, half a day. So like 30, 40 hours, which are great. So yeah, the residency curriculum and rotations are just kind of put together in a way to give you a very comprehensive experience in medicine, so you know everything before you head out. Even if you don't remember a lot, you've done it, experienced it once. So we We do a lot of inpatient stuff, which is on the wards. There are people who are admitted. And so we take care of a lot of those people in the hospital. That's about like a quarter of our rotation too, because a lot of the time, working with those patients gives you a really good idea of like what to do fast, because they're admitted here, they're sick, you want to take care of them. And so we spend a lot of time doing that. About like 6 months or so like that, or 3 months or so of our training is based on taking care of patients who are admitted in the hospital. And then we do spend a little bit of time in the ER as well. So we spend about 2 to 3 months in the ER every year, or like throughout our residency. And then we just take care of patients in the ER, which is extremely crucial for us too. It's something that as a family medicine doctor, you need to be equipped with working with people in the ER who come with acute problems, and you want to take care of it. And then we do ICU as well, which helps you for critical patients to how to take care of them, doing tons of procedures that are very high risk profiles, running lines and tracheostomies and intubations. So all of that stuff. And then there's a lot of like pediatric rotations that we take. We do pediatric outpatient, we do pediatric inpatient, and we do pediatric ER. So all the stuff that we do for adults, we do it for babies. And then we do a few months of OB where we're actually delivering babies. So lots of deliveries, C-sections, all that stuff, because if you're a family medicine doc in a rural area, you're probably going to be delivering babies as well as taking care of the babies after. So you need to be good with newborn nursery, newborn ICU, and then you should be good with like all the delivery process as well. So we do all of that. And then we also do a little bit of time in surgery, particularly trauma surgery. Spend some time doing like small procedures in there, learning like what trauma surgery protocol looks like. And then of course, like some other rotations like geriatrics, gynecology, sports medicine, and a whole bunch of other electives that you can pursue where you do research work, where you learn about dermatology, and all admin stuff. So all of that stuff is like kind of part of the whole residency program curriculum. By the time you're done, like I'm almost halfway through my second year, and I feel pretty good, like an overall understanding of most like specialties too. And so you kind of know like what you need out of it as a family medicine doctor. And if your patient comes in who had a particular procedure, like a laparoscopic cholecystectomy, you know exactly what the procedure is like, you know what to do after, like a lot of the stuff that you've learned on your surgery rotation. And so you can kind of relate to your patient. You're not completely unaware of what's happening. So it's just a pretty like robust, like good residency. I don't know, most family medicine residencies, I believe, focus on outpatient medicine too. Ours is pretty outpatient heavy. So for instance, as you start your residency as an intern, you have one day of the week, which is your clinic, and you start seeing patients over there. Obviously, for anybody, any new doctor, it takes a little while for you to start getting patients. But then as you get older, like for me now in second year, you have 2 full days of clinic. And I have a schedule, and I have patients on my schedules, and my days are pretty packed. I'll see like 10 to 14 patients in a day. And you start getting in the habit of like seeing patients in a clinical setting, which is very different from working in a hospital and in the ER or in the ICU. So outpatient setting, that's kind of what I want to do. So I focus a lot on preventive care. I focus a lot on risk factors and social determinants of health. And that's your opportunity to make relationships and bond with people and their families. So our residency is very outpatient heavy too. So no matter what rotation you're on, you still do a lot of outpatient as well. Like I mentioned, you do get opportunities for a lot of elective time. elective time is your time to think, hey, this is what I'm really interested in. I've had some experience in it, but I want to learn more. And so you can pursue anything you want. You can say, I want to learn more cardiology. You can go and, pursue an elective in cardiology, learn more. You can do research. You can do dermatology. Some people do a lot of procedures and they feel like they don't get enough procedures during residency. They want to do more. They will pursue procedures. And some people will pursue like an executive medicine elective where they're learning more about admin stuff. And so there's a lot of opportunities for you to pursue things that you feel like you need to learn more and just kind of spend some time doing that. Palliative care is a great elective too, to learn about that. All these things are super helpful because it gives you some downtime to kind of mold your residency experience based on what you want to do. So I think that's great for our programs. We do get plenty of procedures. Mostly like when we are in the ER, we'll do a lot of procedures. When we're on wards, we'll do a lot of procedures. If you have a patient and they need a procedure, you're pretty much on the team to do it. We do paracentesis, thoracentesis, chest tubes. And then when with the ER, we'll do tons of intubation, tracheostomies, small procedures in the clinic. We do a lot like mole removals, callus removal, toenail removal, a lot, abscess draining. And then for OB setting and even clinical setting, we do tons of pap smears. We do tons of like IUD insertions for women or Explanon removal and insertion. So a lot of those like contraceptive procedures too that you can do that are fun and easy. You learn them and then, you can help your patients. So those are great. And based on what you want to pursue and how you want to pursue medicine, you always have opportunity to make tracks, which are focused mostly on this part of like your residency that you want to focus more on. So the track, there's like a lot available already for some programs. But for instance, a friend of mine is really interested in homeless medicine. And so she's decided to go do that track, which is the street medicine track. And so she like end up spending extra couple of months doing just street medicine stuff, which is really unique for her. She'll do more time doing that. Someone wants to pursue a preventive cardiology track, they can do the same, and they can spend more time doing that. So a lot of the programs are flexible. If there's not a track already available, they will help you make a track. It is possible, it's not impossible. But several programs already have a lot of tracks that you can just kind of look up from beforehand and be like, this is why I'm really interested in your program. I want to pursue this track. And that kind of just focuses your residency a little bit more on it. So that's great for people who are particular about one thing. And then there's a lot of opportunity for research too. You have to be part of research to do anything in America. And it is important to be up to date with everything that's going on. Right now with COVID, a lot of COVID study researches were going on. We were part of it. We're part of hospital-wide researches to help like find out what's going on with our patients, what we need to do to help them, what's going on with the administration system on the whole that we can help out with. So if you're interested in research, there are plenty of opportunities for that as well. All right, next slide. This one's just a little bit going on the same topic as fellowships. So family medicine has a lot of opportunities for fellowships. We have tons of these that are available that you can pursue after you graduate. Most of them are year, and you can just spend some extra time doing this. There's sleep medicine, sports medicine, pain medicine, palliative care, adolescents, geriatrics, all of these are really popular, but there are a lot more. There's preventive medicine, obstetrics, international. I know some people who've like pursued these fellowships, and then you just end up doing that, which is perfect. Next slide. So this was the Medscape 2020 review for family medicine doctors, and I just wanted to share this with you because, overall, as from what I said, and from what you want from your job is obviously going to be different. But for me, I think that the most rewarding part of my job is also the fact that I have relationships with my patients. I get to know their families, and I get to, be part of their journey, be it their health, be it their life. Like I've seen people who are younger going off to college, helping them with that, getting them into med school, wanting them, if they want to become physicians, helping them with that, seeing their grandparents, then seeing their children. So I think that for me also is like the most important part of my job. And I think if you want to pursue family medicine, that is something that you should think about. Like, do I want that? And if you want that, then this is perfect for you, because this is all about just, making, relationships everywhere, and just actually caring for your patients. And then a lot of the other doctors also shows that they feel the most rewarding part is that they make they know that they're making the world a better place, by helping others. And I think that's really sweet. And several times I've had that experience where, I've done something that's not, in my opinion, that's not a big deal, but it's really helped save someone's life or made someone feel really good about themselves. And for them to feel like they can put their trust in me. So that feeling is just great. I love it. At the end of the day, when you're sitting in your car and you're driving home and you're exhausted, especially during residency and even at work, I mean, you're seeing patients 10 minutes after one after the other. You're exhausted. You sometimes I don't even get lunch break, or I realize I didn't even have water all day and you're just tired. But a patient who said something to you like that makes a huge difference, and you feel like you helped out. So I think for us, that's just the gooey bit that I love. And then just being very good at what I do, finding answers and diagnoses, those are also like important parts. But yeah, there's like, people find the part of the jobs that are rewarding is like them making money or being proud of being a doctor and teaching. But for most part, I think the first two, something to like go home thinking about, thinking like, okay, do I want to be that person who is responsible for families and taking care of them and actually feeling that? So that level of care, if you want to give to your patients, very personal. But yeah, family medicine is all about that. So if you guys want to join us, feel free to do that. We love having other folks around. Our community is like really, really great people. I'm part of several like the family medicine associations, or the American Association of Family Medicine. We have several meetings. I'm the resident secretary, and we're very inclusive and easy to talk to. We're not like your surgery folks that are constantly stressed out and then taking the stress on other people. Most people here are nice, and the life is great. And I think overall it's a very rewarding profession. So if you want to pursue it, I would definitely recommend it. If you have any other questions, feel free to reach out. I just kept this presentation a little bit short, but if you have any questions, feel free to reach out. I'm happy to help, happy to give you some advice and help you during your application process or prior. So yeah, that was all. This is my presentation. There's not much to it, but yeah, feel free to throw on your questions. We'll take some time to do that. And after that, yeah.
Thank you so much, Dr. Badar. As you mentioned, you are from Pakistan. Happy Independence Day. If anyone has any questions, they can feel free to ask now. We will now begin our Q&A session.
Thank you very much for that incredibly informative session, Dr. Badar. My name is Hamza and I'm from New Jersey. I'm matriculating into a joint BSDO program with Seton Hill University and the Lake Erie College of Osteopathic Medicine in Pennsylvania. To start off our Q&A, which medical school did you attend in Pakistan?
So I went to Ziauddin University in Karachi.
All right, thank you for the answer. Did your medical school help you prepare for USMLE exams, or did you have to self-study?
I had to do a lot of self-studying for sure. I spent a lot of time because after graduation, I took like 2 years off to just do some research work. I was working full time, but I also studied a lot. And I was constantly like just doing USMLE prep, first aid videos, just kind of had to study on my own a lot for sure.
All right. How long does it normally take to prepare for steps 1, 2, and 3?
So it depends. So step 1 is the longest, and step 1 is probably the hardest too. A lot has changed now because they're starting to change that as a pass and fail. So it may not seem as hard for people now because you're not constantly striving for the highest score. But I think step 1 studying probably takes the longest. So I don't know, it could be anywhere from 3 months to 9 months of like hardcore studying. And step 2, both the step 2s were pretty simple. I think I spent like 4 to 6 weeks studying for them, and they were a lot easier because they were more clinical. And I think step 3 was probably the easiest. I barely studied for it. My residency prepared me for it, and I still passed. So after step 1, I think everything is downhill, but step 1 is just probably the hardest.
All right, thank you. I'll keep that in mind. After you start preparing for USMLE did you start preparing for USMLE during medical school or after medical school?
I did some questions, some UWorld questions while I was still in med school. Every now and then I got like the whole year subscription for the step 1, and I did some questions, but I think I actually started studying after graduation, because I just didn't have the time to just do a dedicated study time. So I was just like kind of dedicated like 4 months, and I studied really, really hard, and I just gave the exam. So I think that's pretty much what I did.
On unrelated question about like subscriptions, what are some tips and resources you would recommend for USMLE preparation?
So I use UWorld as my primary. I did UWorld questions every day. And honestly, I feel like I've been doing UWorld for the last like 5 years because did them in med school, did them after for all my exams, all the step exams, and then even like now, even in residency, just did my step 3. So UWorld is great. It prepares you really well for the exam, and I just kind of took notes from my UWorld question bank answers and put them together in a notebook and just kind of went over them every day. And then other than that, I used first aid for step 1, and that's about it. And for step 2, CS is, I don't know if they do that anymore. I think they're no longer doing it right now, but yeah, I just did step 1, first aid for step 1, and for the rest of my step exams, 2CK and step 3 both, I just did UWorld. That's all I did.
All right, thank you. From USMLE and medical school, we'll be moving on to family medicine. So are wellness examinations the same for all age groups in family medicine?
Our wellness exams are for all age groups?
Yeah, are wellness exams the same for all age groups in family medicine?
No. So the wellness exam, so the well child exam is different. There are obviously different questions that you ask. The exam is also different for children. And even for children, the exams for like the babies are different, and as you get older, you're focusing more on the musculoskeletal system, on their back, on listening to the heart, for all these athletic kids. So the exam is definitely different for the age groups. And then the questions that you ask are different up until, 18, 16, 18. You're just doing a very basic kind of like food, nutrition, diet, bowel movement, all that stuff. You're talking to the parents a lot more. After that, you talk to the older kids a lot more. You just will focus more on like what's happening in their lives, stressors, anxiety, school, alcohol, sexual activity. So a lot more like social stuff. So the questions change, the exam changes. And then for women, then after that, from age 21 or from age 18 up until like whenever, woman exam. So there are two parts. One is just an annual physical where you talk about a lot of just social aspects of life, exercise, diet, drugs, all that stuff. And then the woman exam is definitely the pap smear, and the STI testing every 3 years after 21 years of age. So that's for women. And then for males, it's just like kind of an annual physical exam, man. And then as they get older, over 65, then you do the Medicare wellness. And then that's a little bit different too. You ask a lot more questions that are focused on their like morbidity and mortality moving forward as they're getting older, talking about advanced directives, their living will, all these questions, change a little bit, asking them about like any social or domestic abuse and all that stuff as they get older. So the exam is for every age group, but it changes for every age group. The questions change for every age group. So yeah, it is pretty subjective.
All right, thank you for that. Are you part of the AAFP or American Academy of Family Physicians? And if so, can you please explain the importance of the AAFP membership?
So I am, actually someone asked me that on the chat too. I was looking at it. So yeah, I'm part of the AAFP. I'm a member. For me, I think it's kind of mandatory pretty much to be part of it because I get my board certification through the American Association or Academy of Family Physicians. That's where I get my board certification from. So yes, I am a member. In order to be a family medicine doctor, you have to be a member. You can definitely be a member as a student. That's definitely possible. And students who are interested in family medicine are there, and there's a huge body group of students who are there, and a lot of the administrative body is also part of students. So I'm actually the resident secretary on there. So I am part of a lot of residency related admin work and questions and talks and our monthly meetings. But there's always a student representative there too. And it's a great way for med students who are interested in family medicine to meet other people. I have had several med students reach out to me through that platform. They've they've asked me like, hey, I want to do an audition at your program. Is that something that's possible? And I've set them up with people here, so I think that's a great way for you to meet other family medicine oriented folks and talk about how they got there, and everybody's very helpful on there too. So if you are really wanting to pursue it, I would recommend it. They have conferences too all the time, which are very helpful. Great networking opportunity and also a lot of learning experience too. So definitely recommend it.
All right, thank you very much for that answer. Why did you choose to pursue family medicine residency over other specialties?
So I mentioned this when I started my presentation. I just wasn't able to figure out what I wanted to do for the longest time. And I wanted to see babies. I wanted to see older people, population. I wanted to do some OB time too. And so after doing a lot of research in cardiology and neurology and surgery, I just decided to choose family medicine because I couldn't make up my mind. I still can't. So I'm just like, okay, I thought I wanted to do everything. So just family medicine is perfect if you want to do everything. It's a little bit of everything. My usual day like starts with an older person, and then I'll see like a well child, like a 3-month-old, or I'll see a sick baby, and then I'll see a pregnant woman, then I'll see like a 90-year-old. Then I'll do a knee injection on a young guy. So it's like it's very, very like fun. It's not the same. It keeps changing. You're constantly doing something that's just like puts you out of your comfort zone, and then at the same time it's different, so it's not mundane, it's not boring, so I love it. I don't know, some people might hate that idea, but if you were into that, it's perfect.
And thank you for that answer. How is internal medicine residency different from family medicine residency?
So it's just right off the bat, internal medicine does not include pediatric and OB population, so you're not going to see babies or pregnant people, pregnant females, and so that's definitely two things that are out. Overall, internal medicine residency, I think, is definitely a little bit harder too. They do a lot more ICU time and a lot more specialty training. Like they do a lot more nephrology, GI. We do a whole bunch of cardiology because cardiology is something that a lot of family medicine doctors like will take care of for their patients. I feel very comfortable doing all cardiology stuff for my patients, just other than for them going in for a procedure. But all other specialties are part of internal medicine training. And once you're done with internal medicine, you have the flexibility of going into either of those specialties if you want to pursue them. If you want to pursue GI or renal or pulmonology, all of those things are not for family medicine. So yeah.
All right, thank you very much for the answer. What are the career options after completing family medicine residency?
So after residency, again, I put some of that in my slides. There's a lot more you can do if you want to pursue outpatient medicine. You can do that. It's a 9-to-5 clinic job. You can be a hospitalist if you wanted, working, or you can pursue any of the 100 fellowships that are listed on the fellowship page. There's like so many fellowships that you can pursue. You can be an ER doc. You can be a specialist if you wanted to pursue either of those specialties. You could choose to just see babies. You could choose to just see older people. You could choose to do OB and become an OB. So there's like a lot of opportunities for you to do that. And then you could choose academics and be a teacher, or you could choose research and do a lot of research too. So there's like plenty of opportunities in there.
Thank you very much for the answer. What makes family medicine residency challenging?
So I think the challenging part for most people is the fact that you are seeing several patients from different age groups. I know that it can be a little bit challenging because care changes a lot for a pediatric population to like in geriatric population. So, everything is just like opposite, different. And so I think that might be the most challenging part where you're juggling with so many different kinds of cases constantly and patient populations. And then you just kind of have to like go back, think like, okay, what would I do for a child here? This is not an adult person. And so kind of doing that. And then, like I mentioned earlier, there's a lot of responsibility on us for taking care of a lot of the social aspects of care too, the social determinants of health. So being a good family medicine doctor means that you have to really care about your patients, make sure that they get good care, and then you kind of are talking a lot about social determinants of health. So that can be a little bit challenging. It can be exhausting. It can be emotionally exhausting. And so you just kind of have to work with your patients on those aspects of life.
Thank you very much for that answer. What are your hours as a resident and how often are you on call? During your calls, do you need to stay in the hospital?
So again, I was like talking about this earlier. Residency overall is pretty similar to any other residency. Hours can be pretty brutal. There are months, especially the intern year is really hard. I definitely worked over 80 hours several weeks. So, you can go up to working 80 hours a week and having no weekends off for several months. Like I think for my first 6 months, I didn't have weekends off. I just had like a random day in the week off, like a Thursday or like a Tuesday. And that's pretty, you know, constant for most residencies. I was not expecting anything better. And after that, as you get in your second year, third year, you have a little bit more flexibility. You have more elective time. So now, like this year, my rotations have been like 40, 50 hours a week. And I do have rotations with weekends off, not all, but some. And so there's some work-life balance moving towards the second year of my residency. But first year of residency, the intern year is pretty brutal, just like any other residency, because you're not any different from internal medicine and surgery. You're doing ICU, you're doing ER, you're doing tons of wards. So so I don't think expecting a residency to be easy would be a good expectation to have starting residency, because it's just hard. But work-life balance after you graduate is a lot better.
Yeah, I've heard a lot about residencies being pretty insane. Our next question is, how would you describe your day-to-day work as a family medicine resident? This is
My day-to-day work?
Yeah, day-to-day work as a family medicine resident, presumably after the internship year.
So my day-to-day changes throughout residency. Every month you do a different rotation to just get a different scope of medicine out of the way. For instance, this month I'm in an outpatient peds rotation, so I do peds clinic every day. My day starts at 7:30. I usually get to work by like 7:30, and my first patient is scheduled at 8 o'clock. My last patient is scheduled at 5 o'clock. I will see anywhere close to 30 to 40 patients a day. They'll be at 10-minute interval. So I'll just it's just a nonstop seeing patients. There's barely lunch break or time for me to even stop and use the restroom or drink water at times. It's just pretty hectic. It's a really busy rotation. And then after I'm done seeing all my patients, I catch up on a lot of work on the computer. I have tons of notes to finish. So I will spend another hour or two finishing up notes and just making sure if there was any medicine that had to be sent to the pharmacy was sent. If the pharmacy had any question, if my staff had any questions, I would answer it. And then my attending will be there too. So if I have any questions for the attending, or if the attending wants to do some teaching, we'll do some teaching. So typically I'll be done by 6. I'll get home at 6:30. So my usual day is about 12-hour day. Right now, I do get weekends off. And this is a reasonably easy rotation. It's considered one of the most easy rotations for us because we do get the weekends off and you get home by 6:30. But most of the rotations are a little bit more hectic. So if you're in the ER, you'll pick up ER shifts. It'll be 15 to 18 shifts a month, and you're working 12 plus hours in each shift. So it's it changes based on what you're doing every month. Call schedule also changes for different rotations. Like when you're an OB, you're on call. When you're on surgery rotation, you're on call every 3 days. You're on a 24-hour call. So you're in the hospital for 24 hours for every third day. So that basically means you have no life. But for other outpatient rotations, you're not on call. So it just changes. It's just different based on every rotation that you're on.
All right, thank you very much for that answer.
Okay.
You mentioned a wide variety of family medicine rounds. Can you tell us a little bit about your favorite family medicine rounds?
My favorite round?
Yes.
I mean, I love inpatient rounding with my attendings. I think rounds kind of depend on attendings too. If you have a great attending, then it's just fun to learn from them and talk about your patients. But I particularly love just inpatient rounding for some of my older patients and more of the adult population. I think it's just easier for me. But yeah, I mean, I think I love just the medicine ward rounding. And it is very attending specific too. So if you have a good attending, you can talk about your patients and they can answer your questions. That's great. It's a lot of fun.
Thank you for that answer. How important is teamwork during residency, and how do you use emotional intelligence during interaction with your colleagues, such as attending physicians and interns?
So teamwork is pretty important. Our program is very close knit. It's pretty competitive. We only take about 4 people per year. So we're like a really close family. But as you start your residency, you don't get a lot of time to hang out with your other co-residents. So you don't interact with your residents a lot, but you do interact with several different attendings. And like I mentioned, because we go from rotation to rotation, so you will be, when I'm in the OB rotation, there are a lot of OB residents that are there, or when I'm in the surgery rotation, there's surgery residents, and the ER, they're ER residents. So most of the time you are paired with another resident of that specialty, which can be fun, which can be challenging. And then the attendings are different too. So it's like, sometimes I have a different attending every day. Sometimes I have the same attending for the whole month. And just being able to build that rapport with the attending, and both of you being on the same page as to what you want as your learning goals and how you want to help patients is just different. So overall, you're just on your own for most part. And I think that's like what residency trains you for, is just to being on your own once you graduate, because you're not going to have a whole bunch of help. And so most of the time we're just on our own. We're seeing patients on my own in clinic. If I have any questions, I have my attendings and I'll just go talk to them, and I'd be like, I have no idea what this rash is. Like, I've never seen this before. Can you help me out? And they'll just, come with me and like kind of like help me out. So that's like a great fallback. But sometimes you don't feel comfortable doing that either. So you're just spending a whole bunch of time like looking up stuff on UpToDate and just trying to see what's the best possible care plan that you can make for your patient, and then kind of present to your attending. But for most part, I think, other than just social gatherings and just hanging out with your residents outside of work, you're mostly on your own. And that's just to prepare you for life, because you're just kind of working. Other than that, I think teamwork with the medical staff is like very important. We work with tons of nurses, and I love all my nurses that I work with so far. Some of the nurses can give like some of the resident doctors a hard time. But most of them have been pretty nice. And so like working with nurses and other medical staff is part of your training, and you're going to continue to do that for the rest of your life pretty much. So it's important to kind of be respectful and professional, ask when you need help, and just kind of delegate orders effectively without sounding condescending. All those things are skills that you develop as you get older, or you see other people doing it and you pick them up. But for most part, like in terms of, just people you work with, everybody's pretty nice. And you get a good amount of like, autonomy when you're working with your patients. So you feel independent enough to like take care of them. And then, yeah, I think that's pretty much it.
Hey, thank you very much for that answer. As a resident, this is an important question. As a resident, do you have more inpatient rotations or outpatient rotations?
So my program is very outpatient heavy. So we do 3 months of, so we do 4 to 5 months of inpatient overall total in our entire residency. You do 3 months as an intern, just starting off. And then in the second year, you do 1 month. And in the third year, you do 1 month. So as you graduate older, you do less. And then at that time, the interns kind of take care of you're just kind of you're just there for the intern as an upper level. So you do and then you do 1 peds month. So that's about 6 months of inpatient rotation experience all for the entire 3 years. And an outpatient is, so starting off as an intern, you have a 1 full day of clinic every week. And then as a second year, you have 2 full days of clinic every week. So no matter what I'm doing, right now I'm in the peds outpatient rotation. I do that. My clinic days are Tuesdays and Thursdays, and they're set in stone because my patients, so that I can have a continuity of care with my patients. I have a schedule. My patients get followed on there. So Tuesdays and Thursdays are my clinic days. I'll work in peds outpatient Monday, Wednesday, Friday. Tuesdays, Thursdays, I'll be in my own clinic. I'll be seeing my own patients who I've been seeing for the last year. And so overall, my residency is very outpatient heavy. And I think I'm very grateful for that because that's kind of how I want to pursue family medicine after I graduate. So I want to be very comfortable taking care of patients in a clinical setting, my own patients, making my own patient load, following up with them, their families, and just taking care of every problem as I know. So yeah, so most family medicine rotations, residencies, I would say are pretty outpatient heavy too.
Thank you very much for that answer. Here's another question. What can be the role of preventative medicine when treating diabetes?
On feeding and diabetes, you said?
Treating diabetes.
On treating diabetes. Oh yeah. So yeah, like family medicine, we're like, if you're in an underserved population like I am, we're the front line for diagnosing and treating diabetes. I think pretty much every other patient of mine is diabetic or has hypertension. Yeah, it's just, you start with seeing an elevation, you do labs for them, or you see that they're obese and they're having some risk factors, and you start by doing labs. And sometimes I will see that they'll be in the pre-diabetic range, and that's when we'll talk about all kinds of preventive stuff. We'll talk about lifestyle modifications and dietary changes. And I like to keep very close follow-ups with my patients. I'll have them back every 2 weeks, just kind of see what they're doing and how much they're doing. But most of them are full-blown diabetics. Their A1C is going to be 13, 19. And at that time, just like, okay, we're going to have to start treatment. And so you work pretty aggressively. And I definitely start from the beginning. I will do all the workup for all kinds of preventive, like, because if you have diabetes, you want to make sure their cholesterol is not off the charts. And then you just want to make sure like all the cardiac risk factors are in check, and you start working on a whole comprehensive care for them, just making sure they're like focusing on their diet and lifestyle. And it's hard for a lot of patients. So I just keep very close follow-ups with all my patients. I see them back every 2 to 3 weeks and make sure that, we stay on the same page. We're motivated to work towards our goal. If we're trying to lose weight, we're seeing every week what our goal was, how much we've done, like what are we eating. I think it's just important for people to stay motivated, to say, okay, I'm going to go see my doctor. I'm going to be answerable to her. She's going to be mad at me. Like, I have to figure out a way to like stop eating all these carbs. And it helps a lot. So like just kind of glucose monitoring and just kind of checking their glucose monitors every 2 weeks and saying, these are your numbers. Like, what was happening last week? Your numbers are higher, or, all that stuff. So I think for us, like, it's just kind of building that relationship of trust. And just also being like really friendly and honest with them, and just say, hey, if you're not going to do this, this is what's going to happen. You keep having abscesses and you keep having infections in your toes. And, at one point we may have to cut your toe off. And then they're like really upset. And then like, okay, we're going to work on our diet. So you just have to be honest with them, and just work, it is all preventive care that we do. And so that's just like helping long-term morbidity or mortality in our patients. And I let them know the same thing. I'm like, I want to keep seeing you. I want to see you healthy. This is something you have to work on. So they're pretty motivated to do that.
All right, thank you very much for answering this question and the last few questions. From now on, I'll be handing over the mantle of asking questions to Zaid. So Zaid, okay. You can now.
I do see some questions on the chat here.
Yes, we usually put them on a document and they'll be asked.
Okay, sounds good. Because I don't want to miss someone else. And yeah, because I am looking at them. I answered some of that stuff already, but I don't want to ignore someone. So yeah.
Thank you,
Dave,
Hamza.
you can take it from
My
here.
name is Zaid, and I'm a rising undergraduate student from California interested in specializing in medicine. So for our next few questions, we'll be shifting into the IMG related questions. So to start us off, the first question I have is, what advice can you give for seeking out research opportunities as an IMG?
So for IMGs, when I was starting to look for a lot of my research positions, I straight up emailed. I went to different programs. I emailed people that were on their research pages. I found some of their work interesting. As I made a cover letter. I put together my resume, and I just kind of emailed everybody. I was like 300 emails, and I was just like, hey, I'm really interested in research. Like, if you have a position available, let me know. And like 5 people reached back to me, were like, yes, no. But yeah, so I think that's like one crude way of doing it. Another way is just reaching out to people who are part of research organizations and research institutions and asking them if they have anything available. You could look up things on a lot of the university hospitals' website and see if they have any positions available for research electives. You can email their program coordinators and ask them. Just kind of reaching out to everybody and just asking if they have anything available that they can put a med student on. So I think it's just, yeah.
Thank you. Our next question is, what was the most challenging part about your residency application?
So the most challenging part about my application was just kind of making sure that it was competitive enough. I had a few research papers on there that I put. And then just kind of like putting together my personal statement, and just writing any deficiencies that I had. I'd taken a few years off of after med school to just kind of do some research and finish up my board exams. So I had to write about that, justify why I did what I did. And overall, I think it was pretty competitive. I sent applications to a lot of programs, and I got a decent amount of interviews, but still, as opposed to graduates from here, there were a lot less.
Thank you. For our next question, is it true that there are certain specialties that are easier to match for IMGs? And what general advice can you give for up-and-coming IMGs?
So yes, that is true. There are a lot of residency programs that are not at all IMG friendly. I think that family medicine is actually one of them. For instance, my program had never taken an IMG before. So I'm like the first IMG in my program. And when I asked my program director, I actually asked this at the interview, because I said, like, I've never seen an IMG in your program before. Like, he was like, yeah, we just don't take IMGs. And I was like, why is that? And then he said, well, we don't know the med school they've come from. We don't know how much they've like gotten training. Like, we just don't take the risk. We just don't take IMGs. So a lot of programs in Texas are not IMG friendly. So when you're applying, definitely keep in mind the states that are IMG friendly. So that's like one of the bigger points. If you're really passionate about family medicine and you still want to apply, definitely apply in like the states that are more IMG friendly. You can get all this data online, but like, for instance, New York, Chicago, all of those areas are like really IMG friendly. And then other than that, I think internal medicine is probably the most like IMG friendly residency. Most of my friends and a lot of pretty much everybody I know is from my med school who matched here is internal medicine and psychiatry as well. So psychiatry as well. A lot of my IMGs from my med school and people I know otherwise have matched there. So those two are pretty IMG friendly. Overall, surgery is not terrible either. If you wanted to pursue it, you could. General surgery definitely is easy too. So yeah, I mean, I guess if you're really interested in it, you could get around to it.
Thank you. Our next question is regarding the pandemic. Given the pandemic, how can international medical graduates or IMGs get letters of recommendation from US physicians since COVID has created some limited opportunities for observerships?
Yeah, so I think that a lot of the programs are also aware of that, and they're being relatively, easier on the candidates about that aspect. So I think, like, at that point, you could just like still have letters of recommendations from your own program or from your own, doctors in your program, and just kind of mention that in your personal statement, the deficiency. And other than that, like if you have a mentor who you've been like kind of talking to online, I think maybe getting a letter from them wouldn't be that terrible. Though it would be hard for them to judge your clinical acumen given that, they haven't particularly seen you work on the field and your skills. So it might be a very generic letter. So, I would argue if that letter would be any better if they wrote a very generic letter for you. So these are things that you just kind of have to talk to your mentors and I think apply still because letters from your program director. I know people who didn't have any letters from anyone from the US and they still matched based on their resume, their scores, and their research experience. So I would still like apply.
Thank you. And did you need an H1 or a J1 visa for residency?
So I did not actually, I'm not the greatest person to talk about this. I did have a green card. I did have an American green card when I moved here. So I was already a resident, a permanent resident here through family. So yeah, I'm sorry, I have no idea about the visa situation.
Thank you. Our next question is, how do the social determinants of health impact clinical outcomes and do they differ by race?
Yeah, so this is a long conversation. This has been like an ongoing issue for a while in medicine. And of course, like the social determinants of health definitely alter a lot of your, clinical setting, clinical scenarios, outcomes, morbidity, mortality. Historically, it's been known like Hispanic and African American populations are prone to be undertreated, just because people don't perceive their pain valid as valid. And so yeah, this is a whole different talk, but yeah, definitely for sure there's a lot of there is a lot that goes into this, and you have to think about these things. Your residency, if it's a good program, will definitely kind of educate you on this a lot and will kind of help you be a well-rounded doctor and not seeing race, and not seeing it as a limiting factor to how you decide to treat someone. But unfortunately, it happens, and you just have to be careful. You just have to keep reminding yourself to give the best care possible, regardless of race or ethnicity.
Thank you. And what are some limitations of working as a family medicine physician in a rural area versus an urban area?
So in rural area, you're just on your own. You are pretty much seeing all kinds of patient age groups. You are delivering babies. You're doing procedures, and so you're like the only doctor there. You do a lot of ER and urgent care stuff as well. So I think there's like a lot on your plate. If that's okay with you. If it's not, then it could get a little bit overwhelming. In urban populations, like honestly, it's harder to get a lot of the other patient age groups because I've had like only a few prenatal care visits, and most patients who get pregnant, I'll refer them out to OB, or they would prefer to go to OB and follow care and be delivered by an OB. I mean, I have like 400 deliveries under my my radar. Like I did 300 last month, but like the point is that just because I feel like I'm comfortable with it, like my patient doesn't have to be comfortable with it. Or in urban population, they have a lot more opportunities to follow up with specialists, and so you just kind of have to talk to your patient and just kind of do whatever they feel more comfortable with. And then I think it just is a little bit easier when it comes to urban populations, because you don't end up doing a lot more comprehensive care. And as a rural family medicine doctor, you're doing everything for your patients, so you're pretty overwhelmed.
Thank you. Given that family medicine residents work in the hospital setting, they often cannot deny healthcare to anyone without insurance. Since most family medicine physicians work in the primary care setting, how do you believe they manage seeing patients without insurance?
So as doctors, this is something that as residents in training, this is something that we don't get a lot of experience in terms of figuring out all this insurance plan. Hospitals that I work with have like an extensive insurance policy staff, and they kind of like do this for us. Undocumented patients several times will come to the hospital, and you are supposed to take care of them, so we do take care of them. The clinic that I work at is also a charity clinic, so most patients there are undocumented, or most patients over there do not have insurance. So I usually work with non-insured patients, and so it's just the organization that I work with. So it's just been easier for me. I think I don't know a lot about insurance and how that works, but there's like staff that helps you out with it. So technically, physicians in America are not that great at that question, and they just work with the insurance staff and just do whatever your organization allows.
Thank you. Moving into our last few questions here, how do you manage your work-life balance, and how has your support system been important to you?
So I'm married, and I don't have any kids, but yeah, being married, and my husband is from medical profession, but he's not a physician. And so he has a pretty steady work-life balance where he works 9 to 5. My schedule changes every month, and some days, some weeks I don't have weekends off, or I'm working crazy hours. So it is hard, definitely, in residency. And like I've said over and over, historically, residency is not supposed to be easy. So you just you don't go into residency with the expectation of having any work-life balance. So whatever you get is really appreciated. But it's only 3 years. And then after that, I think the reason that I did pursue family medicine overall was the fact that I did want to just do a really 9 to 5 clinic, 9 to 5, Monday to Friday clinical setting. I wanted to make sure that I was available on the weekends to spend time with my family, with my in-laws, with my parents, with my husband. And I wanted to take vacation when I wanted. So, all of that stuff. And I think that's particularly why I chose family medicine. We can choose not to take calls. So I don't have to take calls either. So it's not like I'm going to wake up in the middle of the night and have to go help a patient out. So that's something very helpful for me too. It's I finish my work, I see my last patient, and then I actually go home and not have to think about it. So I think work-life balance for family medicine doctors is great. I definitely don't want to be sexist, but being a woman, you do worry about a lot of stuff at home. I want to have a family, I want to have children, and I want to take care of them. I want to take care of my parents. I love them, and I just want to be there for everything that goes on with them. So all of those things, all of those factors play a key role in that, and how demanding your family life is too. And so that's something that you should definitely think about before applying for residency. And even if you're applying for surgery or internal medicine, thinking you want to pursue cardiology, there's a lot more training after residency that goes into those specialized fields that you'll be training the same hours for 9 years. You're working 80 hours a week. Do you want that? How much time do you want to take off to be with your family, to be with your friends, to time to on your own health? Regardless of what I do, I like to exercise every day, and some days I can't, and it just puts a bad impact on my health. So you have to put your health first too. So all of those things are important, but I think family medicine has a really good work-life balance overall.
Thank you. And for our last question of today, what is some advice you have for students who are interested in pursuing family medicine residency?
I would just do it. I think it's a great great field. I think it's a very diverse and multifaceted field. There's a lot of opportunities for you to pursue family medicine, how you want to pursue family medicine. If you are a really emotional, goopy, people loving person and you want to take care of people and help people, I think this is perfect. You have a lot of opportunities to make relationships and actually make a difference, help people. You're the first person who'll be seeing a lot of your patients, so it'll be important for you to make sure that you give them the best care possible. And so I think that it's great. It's perfect for people who are like, for someone like me, I'm still not sure if there's anything that one thing that I want to stick with. And so it's great. It's very, very like diverse. Like I go on from seeing babies to pregnant people to older geriatric population. So it's just fun. It's upbeat. It just keeps you interested. You know, you're constantly learning because there's just so much to learn. You're constantly learning and reading and you're constantly growing. If you want to pursue family medicine, I would definitely, push you to do so. It's a great field.
Thank you so much, Dr. Badar. Those are all of our questions for today.
Okay, well, great. I enjoyed talking with you all. I left my my email address at the beginning of this presentation. If you guys have any further questions, feel free to email me. I will get back to you as quickly as I can, and happy to help out however I can. So just reach out to me.
Thank you very much, Dr. Badar. We truly appreciate you taking the time to answer our questions. This was a greatly informative learning session for all of us. I'd love everyone to please give a warm thank you to Dr. Badar in the chat box for this incredibly informative session.
Of course. You're welcome.
Now we're going to conduct our closing session with our quiz and future session dates. So the link to the quiz for this session is now live, and you'll need a 70% or higher to pass and receive your certification. The link to the quiz has just been sent in the chat. Don't forget to also join our mailing list if you haven't already, as we send session and quiz reminders right to your mailbox. And you can join from the link in the chat below. It was just sent. And now we're going on to our next session dates. So these dates will also be posted throughout our social media outlets, so be sure to follow us at TeleShadowing. And I'm looking forward to seeing you all at our next session, which is next Saturday on August 21st at 10 a.m. Eastern Standard Time, with our physician mentoring us in internal medicine pediatrics. Thank you so much, everyone, for attending today's session, and we hope to see you in upcoming sessions as well. This concludes this week's shadowing.